the mic on my right.
Yes, Jade Stewart from Baytown, and I just like the audience. I have my grandchildren here, and they said they get an offense for the behavior here in elementary school, and you know, I want them to see what democracy is like. I was in a middle school many years ago, and there was a sign up on the wall, and it was by Voltaire. And it said, "I may not agree with what you say, but I will defend until death the right for you to say it."
Yeah.
And I think we have the most wonderful country in the world, and my husband and my son were in the Marine Corps, and they told me, even if people don't agree with you, we fought for your right to speak. And I would just ask that you're all respectful. I respect people that don't agree with me, and I'd like to hear what she has to say about all this. It's very interesting, and I'd like to have a good example for my grandsons. Thank you.
Microphone on my left.
Hi, Michelle. Number one, you're my hero. I love you. I like the fight you have, and I have it in me as well. I want you to know I like to have my health care that I have right now. 3 weeks ago, I had surgery done in my knee. And had I been under Obama's plan, how long would I have had to wait to have two torn cartilages repaired and a bone burr that was as large as a marble? How long would I have had to wait to get that taken care of if I've been under Obama's? My question to you is this: what if the people that you're talking about to get under health care, how are you going to go about getting those people to sign up if they don't want it? And those people that are not on it right now are probably getting them free, and they probably want to stay on it for free. And I'd like to know who wrote the bill, who wrote the amendment for us to go on universal health care, and if we're supposed to be all included in it, are they included in on it? No. I want to know that.
A lot of great questions, and we'll try to answer them. There was an amendment offered in committee, and Dr. Burgess sits on the Energy and Commerce Committee, but there was an amendment offered in committee that said, if this health care bill is good enough for the American people, it should be good enough for members of Congress to go assertion that we should not subject the American people to anything that we aren't willing to subject ourselves and our families to. And unfortunately, that amendment went down in flames, which tells me something, tells the American people something, that there is perhaps something not to be liked in this bill, and we need to think this through very carefully. And I think you had some.
Yeah, that particular amendment in Energy and Commerce was actually struck down on a technicality by the majority. They said we didn't have jurisdiction to consider benefits for the Houses of Representatives, the administration, through our committee. If we don't, I don't know who does, because that's all we do. But it was telling to see it struck down that nobody wanted to be recorded on nobody wanted to be recorded as having voted against that amendment. So they knocked it down.
And as to how long it will take you to get the procedure that you just received, none of us know, because again, it would be up to the people that serve on these boards who would make that decision about how long it will be. We don't know. That's been part of the horror stories that we've heard about in countries where someone other than yourself makes those decisions. That's why we're hearing the debate about rationing. No one wants to see rationing, and one argument that comes out is, well, your health insurance company rations your health care. And that's a viable argument that people can make, but again, I want to have more competition with more health insurance companies. In other words, think in your mind of how you have the freedom of buying your own car insurance. I want to make sure that health care can be like that, where you can go out and purchase your own health insurance the same way you purchase car insurance. Then you decide that level of care, and if you don't like that insurance company, you walk and go to somebody better who offers exactly what you want. Again, you make the decision.
The gentleman on my right.
Michelle, my name is Wayne Johnson. I live in Ham Lake. I'm a Navy veteran. And, as a matter of fact, I was involved in the failed rescue attempt for our hostages in Iran. Wow. But Right. But I would, all of us here want, I think, the same thing. We want good, strong health care. And I believe, as you do, that we have that right now. I was injured in a car accident after the Navy. My injury is not as a result of my service. And I would not be alive today were it not for our medical coverage in this society. And more than that, I didn't have disability insurance, that sort of thing. And so the values that we all share, the values that brought us all here today, is what has allowed me to go back into the workforce, help me go back through school, all of that. We have the greatest country in the world. Yeah. And I sincerely and wholeheartedly am very grateful that you are representing us, because you represent my values. And my question is this then. I worked as an actuary for one of the local companies here in the early 1990s that was one of the only providers of medical malpractice insurance. And where is the tort reform? I suspect we all know why there is no tort reform in the current Democrat bill, because of course lawyers are medical malpractice is a very profitable business. But my point is, where is the tort reform? And I guess I'll leave it at that. But just one last thought is that when you have, in insurance, mine was property casualty, but everyone is insured. There's an old saying, everyone is insured. We are either self-insured or we buy insurance. It is simply a transfer of risk. Our health insurance is not true insurance, and that it is a healthcare service provider. I do not want the government telling me, getting in between me and my doctor. And I've had to deal with healthcare a lot in my life. So I'm going on too long. I apologize. So where is the tort reform? That's my question.
Yes. Dr. Lucas wants to add to this too, but let me just say a couple things quick. Thank you for your service to our country, and we want to make sure that we continue to provide for you and that all Americans enjoy the best health care that we possibly can have. We're here at Oakland Junior High today in Lake Elmo, Minnesota, where we are literally in the shadow of 3M, and also not too far away over just north of us on Highway 10 up by 35W, Medtronic. And if you take a look at the innovation that has occurred right here in Minnesota, a doctor-owned hospital down in Rochester, Minnesota, started by Charlie Mayo and his brothers. That is true medical innovation. We see some of the greatest, finest teaching done at the University of Minnesota Hospital. The tremendous breakthroughs that's occurred in heart medicine, for instance, at Minnesota. But just think, there's a gentleman who was tinkering in his garage in his backyard, and he came up with something called the pacemaker here in Minnesota, which turned into Medtronic Company. 3M, the tremendous products that they have innovated and developed that have added to our quality of life in terms of healthcare. All of this innovation has helped your quality of life, has helped ours. That we don't want to see stifled. When government takes over that 18% of the economy, we know that there will be a stifling on innovation, new products, new drugs, new procedures, new medical devices. That's not where we want to go. We want to encourage the future, because so many of these breakthroughs, well, not all certainly, but many of these have occurred right here in the United States. We do have the finest trained doctors in the world in the United States, the finest trained nurses in the world in the United States, the finest hospitals in the world in the United States. Why do you think that medical professionals want to come here in order to be able to practice and receive their training? Because we're the best. That's why we want to keep it going.